Hi, I'm Dr. Danett, and welcome to Yoni Box. Well, today we broach an age-old topic that we as women have been dealing with forever, particularly those of us who are heterosexual, sexually active, and haven't reached menopause yet, and that is the right birth control. Over the years, I've had patients ask me about my feelings about IUDs, and this prompted this video, which is called "You Down with IUDs? No, no, not me." So shout out to Naughty by Nature for creating the nice OPP song. So the first thing, I mean, clearly you can tell that I'm not a fan of IUDs by the name of this video. But I just have to say some things. So first of all, it can be really challenging to figure out about a birth control and a method that can be used consistently. And honestly, each woman is different. Each situation is very different. And really the benefits of preventing an unwanted pregnancy can far outweigh many of the cons of a particular birth control method. So I say all that to say that it's a very complicated topic, and if you are someone who uses IUDs and it's working for you and it's making your life better and you're happy, then that's great, you know, thumbs up, because it's challenging. And honestly, us as women, we have enough to think about. So it's really nice when you have the type of contraception that you're using in place, and then that's not an issue. So I'm just going to talk some about IUDs now. So IUD stands for intrauterine device, although I give it another acronym for It's an Unbelievable Dream. Okay, I call this contraception It's an Unbelievable Dream because, you know, this is a method of contraception that generally a couple is using when there is for certain sexual monogamy, because this form of contraception does not protect from STDs. So you've got the love of your life and you're able to have sex and not worry about getting pregnant, and you're not worried about STDs, and life is just wonderful. It's always in place. So once you have an IUD put in, it's always in place. So that increases the likelihood of spontaneity, which is always fun. And you know, there's a high, they say that it's more than 99% effective for preventing pregnancies. And when people get them put in, they can last for from anywhere between 3 to 10 years, and that's hella cheap. So that's another plus for the IUD. There are two types of IUDs, the copper one and the hormonal. And some literature, I haven't seen it all over, but some literature shows that IUDs can lessen the likelihood of endometrial and cervical cancer. It's always interesting to see who puts out this research, but that's what some of the literature shows. So if IUDs have all of these wonderful things about them, then why am I not down with IUDs? So let's say you're in a monogamous sexual relationship, you're not worried about STDs. IUDs work by stopping the sperm from getting to the egg. Now, as a traditional Asian medical practitioner, let's look at what an IUD is. It is a foreign object. It is something that is not a part of your body. And when you give your body anything that isn't it, it kind of looks at it like, well, what are you? And it does different things. You never introduce a foreign substance to your body and your body's like, oh, okay, it's fine with me. It figures out, you know, are you a part of me? I don't think you are. If you're around for a while, then it may, you know, grow around it. But oftentimes, if it's something that's foreign, your body will work to strategize and attack on it. And it's not, IUDs aren't like diaphragms where you're leaving it in temporarily. Most people are leaving them in for months, years, sometimes up to 10 years. And that's a lot, I believe, for someone's body to have to contend with. again, as a traditional Asian medical practitioner, you know, I'm looking at things from an energetics level. And the hormone releasing IUD, it stops the ovaries from releasing an egg. Just think about that for a minute. It stops the ovaries from releasing an egg. That's what ovaries are here to do. So it really causes stagnation when you try to stop something from doing what it's here to do. It's like stopping our sweat glands from sweating. It's like getting Beyonce to not dance or sing. It's like getting my 4-year-old to be still. You know, it's like putting kernels of corn in a heated pan and asking it to not pop. It's a lot to ask, and there's always backlash when you really try to prevent nature from happening. And as a traditional Asian medical practitioner, stagnation is like the antithesis of health, preventive wise, condition wise. We just don't want stagnation anywhere. And then when you're talking about the reproductive system, it's just, from my personal training and opinion, not something that we want. Now, the one time that I will give IUDs a thumbs up is in the event that you have a slip up, you didn't use birth control, and you were exposed to sperm. You know, you got wrapped up in the moment, or whatever happens, you know, how life happens. The IUDs, particularly I believe the copper IUD, can be used as a form of emergency contraception. So as long as it's within 5 days of exposure to sperm, the doctor can put it in, and it can help to prevent an unwanted pregnancy. And then it can be taken out, I think, after the next cycle or something like that. But, you know, for emergency contraception, I give it an okay. But in terms of just something that's just in your body for long periods of time, I don't agree with that. So also what happens is, as your body is forming this attack on this foreign entity, there are things that other literature shows as well, where some women develop a low-grade infection, and using IUDs actually increases your likelihood of infection. But some women experience or have a low-grade infection, and this is from the body, I think, not knowing, you know, is trying to figure out what to do with this thing. From that, scar tissue is developed, and increased white blood cells are produced. So your body is in attack mode. This energy that it's using for attack mode could be going to other places in your body that needs it. So that's also a thumbs down for me. I also give it a thumbs down for that reason as well. And it's interesting, you know, some literature says, oh, you know, IUDs, when they're removed, it's no problem. Fertility can just happen. And then some other literature, you know, shows something different, that that there can be an increased chance of infertility that can happen as well. So that verdict is out there, but you also have to look at who puts out what literature as well. So those are some of the reasons. I mean, there are other things that go on with IUDs. They can slip out. They cause longer and heavier periods, which, you know, as women, I have mentioned this, that there's a deficiency of blood, or we have a tendency towards blood deficiency, so we don't need anything that's going to cause us to have longer periods, heavier periods. There can also be spotting that happens, increased vaginal discharge because of the irritation that's going on, increased likelihood of ectopic pregnancies, increased chances of ovarian cysts, which are benign, but why would you want to do that to yourself? And increased pain, sometimes with periods as well. So there are a bunch of reasons, bunch of side effects that can happen. So you know, again, as a doctor of acupuncture and Asian medicine, you know, I strongly believe in the body's natural healing intelligence, and exposing it to foreign substances or foreign things is just something that isn't generally so helpful. And it's funny because, you know, they have this statistic that it's like, you know, more than 99% effective, and it's all about, you know, who you know and whatever. But I did have a patient who got pregnant while she was using an IUD. So she was one of the rare few, I guess. But I don't know. I just know that I have seen someone get pregnant using an IUD, even though it's considered to be highly unlikely. It does happen. So let's see. And I've seen, you know, there are other health issues that can arise when your body is in attack mode, such as the increased white blood cell count and the scarring. There are other actions that your body is taking as well when it's on defense. So those things are significant. If you are in a sexually monogamous relationship, there are options. One of my favorite things I love is I like combinations. So you can use a fertility awareness along with a diaphragm, which I'll talk about sometime in another video. Or better still, and I love my fellas, and we as women, we have our libidos and our needs, but lots of times it's the dudes who are really into sex. Not that we aren't, but some dudes, I don't want to classify it, but some guys are more into it than some women are. If that's the case, then see what he can do. Maybe he can get a vasectomy. Uh-oh. Don't tell him I said that. But it's true. I mean, I've known men who've done it, and, you know, in the event that they wanted to have a child, had it reversed and was able to have children just fine. So, or whatever, or not the guy, but it's worth thinking about because so much falls on us as women. And I think that this is a topic that just greatly affects our health. You know, once you've conceived, you know, your life is changed, whether you decide to carry out the pregnancy or not. You know, we're just different from it. And so I think it's really important to get to think about it broadly in terms of, you know, how these things affect our body, and if it's something that's happening between two people, how to spread the responsibility, spread the wealth. So that wraps up this video for You Down with IUDs. No, not me. If you have health questions or would like some assistance with women's health complaints or other health complaints, you can email me at info@backtothemiddle.com. You can also check us out on yonibox.com for more women's health information. And if you haven't, please subscribe to our Yoni Box YouTube channel. So I want you to take really good care. I'll see you next time, and love being a woman.